Hi guys, I'm Gareth and welcome to our Dentistry Cribs. So we've created an environment which is designed to be as patient friendly as possible. We've got a coffee machine with bean to cup. We have a wide selection of sugar-free drinks in the fridge. As you can see, there's the curved walls with the special pattern wallpaper we've had to have from the United States because we couldn't find anything like it in the UK. The design continues with this open space in the waiting area. And to add to the ambience, part of our design is actually the music levels and how the music is played and what music tracks are selected. Okay, let me bring you through to our brushing stations, just right here. And as you will know as dentists and hygienists that most patients don't know how to clean their teeth properly, and we feel prevention is a central part of the practice and our core business beliefs. And so we've designed this area, which otherwise would have been dead space. We've turned it into a very effective area for teaching patients and demonstrating to patients how to do the most effective type of oral hygiene. Okay, let me bring you through to our consultation room. So this is where all patient journeys really begin. So we've offered them their drinks. They'll have a seat here with the TCOs and have a conversation about their issues, and a questionnaire will be completed. The TCO will then bring the patient over to the chair here and they'll scan the patient so we have a total digital record of their teeth and the surrounding gums. And we find this very useful throughout the entire process. So the TCO can show them a simulation in this room, and then we can use the same scan on the homepage inside on our screens in the surgery to show the patients the detailed issues in their mouths. Okay, let me bring you through some of our surgeries. Just right through this way. The Belmont Euros chair, this was the first one fitted in the UK. It's always a little bit of a challenge in fitting a new chair because it hadn't been really tested. But we believed in the brand and therefore we were happy to give it a go, and we've been very delighted with it. We've got several others fitted in other practices at the moment, and we're very pleased with them. It has fibre optics, reduced handpiece, and all the gadgets that everyone seems to enjoy. But more importantly for me, it's a really reliable chair. The other features of this surgery, we use direct digital X-ray equipment. I've always been a big fan. I've used it since 2003. It's very much interactive, so we have the screens on the ceiling which are used for not only entertainment but also for showing patients intraoral camera images, or from the scans we've taken earlier, we use them for demonstrating the simulations, or we can use the viewer to show the patients detailed images of their teeth and their problems. This is one of our standard hygiene rooms. And in here, this is where all the real interaction happens between the practice and our oral hygiene providers, because we feel that the correct oral hygiene products are critical to delivering success in a preventative program. Brushes like the Oral-B and the Oral-B have lots of new brands out, but to be honest, I've always used Oral-B for the last 20 years. I just find it a very straightforward, simple brand to use and reliable. So basically that's why I've used it. I know they've got lots of fancy things added to them now, but personally I've just always used them because they're a good solid brand, and they're a great adjunct to our advice. So we can't give the advice without the correct equipment to actually for the patients to carry out that advice. So let me bring you through some of the ancillary parts of the practice. Decon area, which is one of those very important necessary areas. It's well located, not far from the surgeries. And bringing you on through here, we have our hand oil machine. Basically happens to be a Plamica, and it's used purely for here for general dentistry and orthodontics. This practice, where we don't do implants here, at our implant practices we have a Carestream CBT machines, and the patients are referred from here to there for those procedures. When we open a new practice, we open it with only a couple of surgeries, but we always have the next surgeries all wired and plumbed ready for opening, so that as we grow, we don't know how quickly we're going to grow in each place, and if we grow very quickly, we know we can get a surgery in within 6 weeks. And at the moment, we're having a new surgery placed in here in the next 6 weeks. So basically, that's happening very soon. And then to bring you through here, this is the staff room. I think it's so important to consider the quality of the staff area as much as the rest of the practice, because we've got to look after the staff as well as the patients. And so we put a lot of energy into finishing and how we provide for staff comfort. These guys even have a dishwasher, believe it or not, which I think brings up the usual argument that most families have, is who's going to load the dishwasher? So it solves some problems and creates others, but still it's a nice problem to have, I guess. And I think the staff enjoy spending time in here because it feels like you're away from the practice for a few moments. Well, thank you for joining me at our Beyond Dental practice in Leamington Spa, and this has been our Dentistry Cribs.